Hey everybody, welcome back to my channel. Today we're going to be talking about Meniere's disease, right? And the pathology is like this. Like you have your vestibulocochlear apparatus of the inner ear. So this is what we call endolymphatic hydrops, where this apparatus becomes fluid filled, and that is what underlies the pathology here. So the main symptoms of Meniere's disease. First of all, you're going to have both auditory and vestibular, right? This is positive. In some cases, the auditory symptoms can be more and the vestibular can be less. In other cases, it's less auditory, predominant vestibular symptoms. The auditory symptoms are going to be tinnitus, muffled hearing loss, right? And you can also have like fullness in the ear. The vestibular symptoms are going to be dizziness, vertigo, imbalance between episodes can also happen, and nystagmus, and head motion sensitivity. This particular symptom is a little less pronounced than what you see with benign paroxysmal positional vertigo, but it still can be seen in a number of patients, right? So next, how do you manage a case of Meniere's disease, right? So first things first, a patient is asked to avoid allergens, the ones that can cause the hydrops to develop. Caffeine, nicotine, allergens, caffeine, nicotine, and alcohol, right? And you can refer them to vestibular rehab, right? And there are certain drugs that can be used in the acute phase. First one of its kind is diuretics, like hydrochlorothiazide and triamterene. Anti-nausea meds like dimenhydrinate, right? And the next one would be vertigo meds like meclizine, promethazine, and diazepam. And the last one is beta-histine. This is supposed to cause vasodilation of inner ear blood vessels, and sort of reduce the edema locally over there. So this is it about Meniere's disease. I do want to include a DDX section, the differentials. So the first one will be BPPV, but you want to remember that the head motion sensitivity is a lot more, and then the vertigo with BPPV is a lot shorter in duration, right? The next one would be an acoustic neuroma, right? it's a tumor of the eighth cranial nerve. And the last one would be a vestibular migraine, where the symptoms themselves are that of a vestibular nature. The migraine itself is vestibular. Do not confuse this with aura. Even people with vestibular migraines, they can have visual aura or auditory aura, and then they come up with vestibular symptoms when the migraine itself kicks in, right? So those are your differentials for this disorder. And I hope this was helpful. Please let me know if there's anything about this that I can clear up. You can put it in the comment section, and I will see you next time. Thank you so much.